great improvement to what she was 6 months ago. It's a different person, and it's a revelation really. It's great, and it just shows to me that it was worth doing and worth persisting. And sometimes people don't get improvement. We have to accept that. And every study done on this condition in the past has shown that it's not 100% guaranteed. Only 70 to 80% of people will get significant improvement. So that's a lot, 10 or 20 to 30% that won't. So we have to accept that. But in Adele's case, it was slow in coming, but it's been fantastic.
So what do you believe has been a catalyst in aiding Adele's massive recovery that she has made to date?
Well, I think it's obviously a combination of things. So the shunt has allowed the CSF circulation to revert to normal, so that there's been some drainage, and it's taken a long while for the brain to adapt to that, a couple of months after surgery. That's certainly well documented. But in addition to that, it's been the intensive physio and rehab that's been provided for her. So there's two things. Obviously in that is a very supportive family. So, and that's probably the most important factor. So all those things together result in a good outcome for Adele at this stage.
What is your message to people who have family members who find themselves in a similar situation as Adele?
Well, most people that have age-related deterioration in functioning and mental functioning, etc., unfortunately going to have a form of dementia or Alzheimer's type dementia. But it's still worth considering some of the reversible causes of dementia, like just normal pressure hypercephalus. And it's straightforward to investigate. It's not always possible to get the diagnosis, but easy to get tests done, such as CT scans, and it's easy to consider it as a possibility. Now, a lot of times, and I've seen lots of people as well, and I'm sure neurologists around town have seen lots of people where the diagnosis is considered, but rightly so, they say, well, it's not this condition, it's not normal pressure hypercephalus. Unfortunately, it's just an age-related deterioration. We can't do much about it, but I think it's just worth keeping in mind, not just for family members, but for medical practitioners as well. As I said at the start, I think that it's an underdiagnosed condition, and as I said, it's straightforward to diagnose, consider, and the treatment straightforward.
So is there anything that you would like to add now in this interview from your own point of view?
Yeah, well, I think it's important to keep in mind though, shunt operations, which I didn't mention, is basically putting a tube into the brain and draining fluid out by a one-way valve into the tummy. It's a straightforward operation, but it's not without risk, and people with this procedure can have complications, and those complications can be serious and even life-threatening. So it's not a trivial undertaking, and I've treated a lot of people with this condition with shunts, and a few stick in my mind because they have had problems. They've had complications and hemorrhages and fluid collections on the surface of the brain, which is the main problem we're worried about. So it's not trivial, it's not without risk. I'm glad Adele hasn't suffered, and I'm glad she's done well, but it's not for everyone, and although we'd like to help everyone, sometimes it doesn't happen. But I think it's, again, just to reiterate, it is underdiagnosed and undertreated, therefore. So I think there's a lot of people out there that have the condition and would warrant treatment. Now, out of, say 100 people out there that need treatment, there might be, instead, 70 or 80 that will do well, but 20 to 30 won't do well, and there'll be also some that will have serious complications in that group. So it's a matter of considering the risks and rewards. Right, so the other point I didn't make mention of was that whilst Adele was in hospital, one of the tests we did was a lumbar tap test, and she showed a great improvement after that, which was temporary. So what we do there is just take some CSF out of the spinal canal and see how their walking goes, and Adele showed a great improvement. And it is temporary because the CSF will quickly build up again. Alright, so that's the reason. So CSF is turned over 3 times a day. So it's about 450 mils of CSF produced every day. So it turns over 3 times a day. So that's why it's only a very temporary thing. So, but it's a diagnostic thing. So if people get improvement with a tap test, then we can be a bit more confident that a shunt's going to work. And that was the really point. Alright, so that's another test. It's not always done. Look, there's dozens of different tests for normal pressure hydrocephalus. None is perfect. And the only true test is actually to put the shunt in and see how they go.
So would you like to stand up with Adele and show everyone that you're in fact her doctor and she's here today with you?
Come on, Adele.
You walk over to him.
Okay, so turn around and face the camera, Adele. And
Up front.
there you go. So Adele couldn't stand when I first saw her. She certainly wasn't talking, were you?
No,
No, not much at all. And couldn't get out of the wheelchair. It's fantastic to see you like that, okay? Well done. Alright?
Thank you. Thank you.
No problem at all. Okay? Very good. Well, thanks for coming down and showing me how well you've done it. Alright?